Hi there, my name is Winnie Wu and I'm a pelvic floor physiotherapist and owner of Papaya Clinic in Sydney's Inner West. Today, along with the team at Confidence Club, I want to teach you some important facts about the pelvic floor. Everything from its purpose and function to how it impacts continence. Before we dive in, I want to note that you should always seek professional advice for your individual circumstances, whether this is from your GP or a pelvic physiotherapist if it's a pelvic floor related issue. First thing first, what is the pelvic floor? Now, pelvic floor describes the pelvic floor muscle and the layer of connective tissues that make up the floor of your pelvis. It consists of muscles, ligaments, and connective tissues that stretch like a hammock from the pubic bone in the front to the tailbone at the back, and side to side in between the sitting bones as well. Now, when you look underneath, this is a urethral opening, and this is the vagina, and this is the anus. The red muscle layer that you see here is a superficial pelvic floor. The superficial layer's main action is to contract and relax. So when you contract, it will come together like this and close into the entry. You can actually see the tissue comes together. It's like an eye pupil constricting. When you relax, it will dilate and it widens. Now, this is a very important mechanism to make sure that we are continent and that we can control our urine flow, as it generates the pressure that is required to shut the urethra. If your pelvic floor isn't strong enough, or there is a compromise in the integrity of the connective tissue, this will hinder the mechanism of the closure of the urethra, and you may leak. Now, deep inside this layer of muscles is the deep pelvic floor muscles. When you contract, this layer will lift. With this sitting right at the base of your pelvis, its main function is to support the pelvic organs that are sitting on top, namely your bladder, your uterus, and your rectum. So what makes a healthy, functional pelvic floor? We want the optimal function to support you through the activities that you need to perform. It needs to have the ability to contract fully, relax fully, and have the endurance to hold for a certain period of time. We want it to understand what is 100% contraction and what's 50%, and you're able to adjust the contraction based on the activity that you're doing. As for signs and symptoms to watch for that may indicate that your pelvic floor isn't functioning optimally, first is leaking. There are many different types of incontinence, but the most commonly seen in clinics are stress urinary incontinence and overactive bladder. Incomplete emptying, where you feel the urge to go again within the 10 minutes. Or post-void dribble, where you stand up and there's dribbles of urine. Frequency of urination is normally around 6 to 8 times per day. And if you have nocturia, it means that you're waking more than twice per night to empty the bladder. Other symptoms are deviated stream of urine or hesitancy to urinate even when you feel the urge to go. When it comes to looking after or preventing pelvic floor dysfunctions, some of your options include pelvic floor muscle training. This should be individualized to your symptoms and life stage. This is especially important because there is no one-size-fits-all exercises. We can also have pessary or vaginal devices to support the tissues, vaginal weights and cones to improve pelvic floor function. And a thorough assessment includes checking for any infection or inflammation to see if that's contributing to your symptoms. Sometimes a blood test is necessary as well. We can do digital pelvic floor examination with a pelvic floor physio, or use biofeedback or other devices to help to get a contraction and understand the muscle layers, so you can practice at home to build up strength, coordination, and endurance. Sometimes you might require a urodynamic test, and this is a test of the bladder and urethral sphincter function using computerized equipment. Now, lifestyle additions or changes includes general exercise to reduce weight and loading on the pelvic floor, good drinking habits, good bladder and bowel habits, and looking at dietary supplements. Thank you so much for watching. I hope this video has given you some helpful and practical information on the pelvic floor. Take care, and I'll see you in the next video where I'll share some beginner level pelvic floor exercise you can try at home.